Hi, I'm Danielle Matus here at Caring Medical Florida, and today's topic of conversation is pelvic pain and pelvic conditions that are treated with prolotherapy. Lots of pain generators in the pelvis, so not just the pelvic floor we're talking about, but pubis, sacroiliac joints, kind of all around the whole pelvis. Things like low back pain, buttock pain, pelvic floor pain, pudendal neuralgia, just to kind of name a few. Do we tend to see it more commonly in females? Yes, but it's not exclusive to them. Males can get pelvic floor pain as well. It is true that a female pelvis is a little wider. This is, of course, for childbirth and so forth. But in general, we still have the same kind of setup. We've got the base of our sacrum here, sacrum, tailbone, the ilium that wraps around here, and then we've got the pubis right in front. And really how I explain this to patients, I try to keep things very simple, is you've got your pubis that anchors these two bones in front, and then you've got your sacroiliac joints right here that anchor these bones in the back, and those are main stabilizers in the front and back of your pelvis. So if you think 3D, if you've got instability in one or several of these joints, like your pelvis can almost act like the seesaw if it's very, very unstable. This is a bare graphic of ligaments that support our pelvis. So you can see here, these blue, these are kind of main ligaments attached bone to bone. So these are primary stabilizers in our pelvis. When ligaments become injured, they get stretched out, maybe partially torn, and they become weak and they can't hold the bones together. That's when you get joint instability. So specifically, we're talking about the pelvis. That's when you would get pelvic instability. So this is kind of a rear view here of the sacroiliac joints here. Again, if those are wobbly, let's just say wobbly, if your pubis is wobbly, then your whole pelvis dynamic is off. This is just a kind of a more in-depth look. This is specifically in the posterior part, the back, like the sacroiliac joints and those ligaments. Also iliolumbar ligament as well, that kind of sits kind of on top of there. And then even into the ligaments that connect to your sits bones, so your ischial tuberosities, those are the bony prominences that you sit on, and your tailbone. All of these ligaments can be stretched out. Trauma, overuse injuries, bad posture, things like that can all contribute to these ligaments loosening and leading to pelvic floor dysfunction. When you have a ligament injury, kind of like I said, you have excess motion, right? Excess motion means excess pressure, right? If the whole area isn't stable and it's moving more than it should, our bodies aren't built to accommodate that long term, right? So you get all this excess pressure. That's when you start to actually get tissue damage. In this office, we commonly call this a joint gangrene cascade, meaning that when you have a ligament injury that throws off the dynamics of the joint or the kind of whole general area, over time, your tissue will die from the increased force. That does not mean there's no way to reverse it. That's not what we're saying. That's where prolotherapy can come into play, but this is what happens over time if it's not addressed. Here's an example of a basic kind of pelvic x-ray, okay? So right in front here, that's where that pubic symphysis is. These are the hips on either side, and as it kind of wraps around, then you've got both of your SI joints there. So when somebody comes into our office with any kind of pain around the whole pelvic area, we really have to look at all of these things. It's not a very localized exam. We have to look at the hips, we have to look at the SI joints, we have to look at this lower lumbar area, we have to look at the pubis and kind of put a whole picture together of what their entire pelvis looks like. Because if somebody came in, let's say somebody comes in with pubic pain, okay, so we'll address the pubis, we'll examine it, we'll look at it, we'll measure it, on ultrasound or x-ray, but then you really have to also examine the hip. They're right there. And I probably couldn't even count how many times people have come into the office, even kind of the opposite for hip pain, but they also have a widened pubis, and so you really have to put all of these pictures together. Someone has pubic pain, but they also have unstable SI joints. Well, what do you think is going to shunt extra pressure, to those areas? There's minimum 5 main areas that we need to evaluate in patients with pelvic pain. This is a really good example of something called sclerosis. Okay, so you see all this kind of extra whitening of the bones here versus what they look like up here. That's what sclerosis looks like on an x-ray. So basically, it's a sign of joint instability, okay? Now, typically what would happen before sclerosis is you might see a cyst. That's not always going to be picked up on imaging necessarily, but if we try to keep things simple, this is maybe a very, very simple analogy. when you have increased motion, right, between your bones, and there's that extra friction, that's when your body would make a cyst, okay? So think about it as if you're wearing shoes that are too tight, right? And you get a blister from that excess friction. Well, let's say you continue to wear those shoes, or let's say that joint instability is not fixed, okay? Eventually that blister might kind of turn into a callus, right? So eventually, instead of like seeing cysts, you're gonna see the sclerosis or this hardening, okay? It's not really a callus, but trying to just kind of create an easy analogy here. That's what happens in instability that continues to go on. This is actually somebody that was recommended for a spinal fusion, but ended up doing very, very well and got back to full function with prolotherapy, which is really cool. Another thing that's really important to remember, and this is true for all joints, but especially in the pelvis, is bones and nerves lay really close together. Okay, so the nerve actually lays very close to the bone because what should happen is the bone should protect it, right? Like if somebody kicks you, you don't want that to cause nerve damage, right? That nerve should be really protected. However, think about it. If the bone is moving more than it should and it's not staying in place, well, what lays right next to it? The nerve. So if you do have excess motion, like at your SI joint, pubis, wherever, and that pelvic area is unstable, one of the nerves that can be affected from that is your pudendal nerve. So people may have heard of the condition called pudendal neuralgia, which basically just means there's pain related to that pudendal nerve. Now, there definitely are times where patients, they have a nerve pain and they get a nerve block or a steroid shot or whatnot, and it takes it away completely. Fabulous. Those are typically not the patients that we see. We see the people that have this chronic pain. They've done all those things. They've tried the shots. They've tried the pelvic floor physical therapy or even more traditional physical therapy, chiropractic care, all the things. And they're still left with this pain that they just haven't been able to get on top of or resolve. Those are cases, like let's say somebody with pudendal neuralgia comes into my office with that history. Those are cases where we say, okay, we know where the pudendal nerve is. What is going on in these 5 areas? What's going on in both of these sacroiliac joints? What's going on in their hips? What's going on in their pubis? And really trying to determine if there is instability in any of this whole pelvic area. Is that the missing problem? That's what's putting pressure on the nerve. Because if that's true, you could do injections on the nerve all day long. But if that bone keeps smashing in it, you're not going to make headway with that until you resolve the joint instability. Again, in these chronic cases that typically are the ones that I see, these are all things, in my opinion, that really do need to be evaluated to try to fully understand this patient's chronic pain.